virus is exacerbating systemic healthcare discrimination against people with disabilities and those who are medically vulnerable. Staff in various levels of government, in service provider agencies, and in healthcare are ignoring the cries of frustrated, anxious families and adults living with disabilities, who know that they in fact qualify for a vaccine but cannot obtain a verification. And many individuals still cannot even confirm if their name is on a list that has been sent to Concord. Attempting to work collaboratively with public health officials, disability professionals have shared feedback to and made recommendations for resolving glitches in the vaccine rollout for Group 1A and 1B as it relates to the disability community. The lack of clarity and consistency in vaccine guidance by the gatekeepers of the vaccine is unnecessarily leaving the disability community ignored, further isolated, and left behind. We understand this is a public health crisis. We know that staff at the New Hampshire Department of Health and Human Services, healthcare providers, and hospital systems across New Hampshire, we know that they are all working tirelessly, and we appreciate their efforts. However, there must be accountability when clear healthcare inequity continues to go unresolved. Leadership, that is, Governor Sununu, must instruct COVID operations staff to eliminate the barriers and implement solutions to provide those qualified in the disability community with easy access to registering for a vaccine before allowing phase 2 to begin. We have with us today Granite Staters whose lives are touched by disability and who will speak to the actual ongoing challenges in the rollout of Group 1B. First up is Jackie Sullivan.
My name is Jackie Sullivan, and I'm from Brentwood, New Hampshire. I have an adult daughter, Becky, who is 26 years old. She has severe nonverbal autism and many other pandas, and many other medical diagnoses that impact her daily life 24/7. I want to emphasize that these vulnerable adult children, like my daughter, will have no healthcare workers available to them if their parents who are working as unpaid healthcare workers get sick. If I get sick, there is no one else to take care of her. This will cause a huge burden on the health system or ending grievous neglect and abandonment of this very vulnerable population. This population that no longer living in long-term facilities, even though they do qualify to live in long-term care facilities and therefore would have been addressed under 1A. They're living in homes and being cared for by their family members. Therefore, this has not been addressed. They're living at home during a pandemic. If placed outside of the home where there is knowledgeable caregivers, they become ill and cannot work. There are people who step in. They have to legally step in and take care of their residents in these facilities. But in the home, there is no knowledge or someone to call or a backup system. My daughter would probably end up in a very overtaxed emergency department. There is no known public statement about how this scenario would be handled. Parents working as unpaid healthcare workers have been completely abandoned during this. We have not been mentioned. Now we have been left to consider lying, basically saying that we are paid healthcare workers on the VAM system in order to access a vaccine. And we would like a statement that says that we are eligible and we are recognized. Now there's no clear instructions of how we would be implementing into the system and how we would get our vaccine sooner than later, ahead of the huge masses that will start when it goes to the second layer. The task we cover for Becky's care includes everything from getting her a glass of water, toileting, personal hygiene, medication administration, personal care. Every element of her basic life needs to be taken care of by us, her family. Having to work an abnormal amount of hours due to the workforce workforce shortage, which is we're supposed to have 3 full-time staff. For the many months of this pandemic, we only are down to 1 full-time staff, which means my family is filling in the rest of her care. I also have to maintain other household duties, care for my family members. It is stretching me to the limits. If one person in my family gets COVID, I don't know how my household will survive. We will be in total crisis. And it's a very scary thought because there's no backup plan for us. Thank you.
Thank you, Jackie. Next, we are joined by Lisa Stedman. She is a parent of 3, raising her family in Troy, a member of her local school board, and she actively supports families living with disabilities. You are muted, Lisa.
I see that. Good morning. I just want to address the difficulties that we've had in registering for a vaccine. In early January, the Department of Health and Human Services began sharing details of plans to initiate phase 1B of the COVID-19 vaccination allocation plan. It was a really exciting time for all of the people who were qualified, and they were to start registering on the 22nd so that vaccinations could start a week later. The guidance available in early January indicated primary caregivers of a significantly higher risk individual, those of all ages with 2 or more underlying medical conditions would be eligible. It was an incredible feeling to know that somebody advocated for our inclusion, and the hard work that they did paved the way for a needed benefit for a population that's often overlooked. I made a post in a group of Down syndrome parents, and I just wanted to be sure that I was understanding correctly what this really meant for us. It drew 79 comments. Initially, we were all excited, and then there were questions about logistics, followed days later by complaints and lament about not being able to access information about registration. So the story I share with you is mine, but it's not unique. The Monday after learning of our eligibility, I contacted my son's pediatrician's office. I requested a letter stating that my son's multiple conditions would qualify him so that I could present it to my PCP, who I thought would add us to a list of eligible individuals. The letter was ready a couple days later. I asked to be put on the list, and everything seemed very simple. An email from the area agency at the time emphasized, get on the website as soon as possible when it opens on the 22nd. And I didn't worry because I was all set, I thought. A few days before registration was about to begin, the pediatrician's office sent me a note saying that vaccinations wouldn't be happening at Dartmouth-Hitchcock, they'd be happening off-site, and there would be no list at all. So my pre-work hadn't yielded any advantage in obtaining an opportunity to register. The process was entirely unclear. The need was recognized through advocacy, but someone dropped the ball on creating a pathway for implementation, and the communications that were created were put together carelessly. I'm referring to the original infographic, which showed that caregivers of adults would be included, and that's a completely separate beef. It gave the impression of, okay, fine, you can have what you want, but good luck getting to it. And so the parents were given the responsibility to learn or create a process. Why are we educating the providers when they should be educating us and walking us through the process? I believe it's because DHHS set them up to serve the standard customers very well and left them entirely in the dark on how to serve our population. So I attended every parent chat and town hall. I listened to every radio broadcast that was available, and I shared what I learned from them with my pediatrician's office. I wasn't getting very far. I changed course and I asked the PCP. I said, my husband, Michael, and I fall into phase 1B because our son is 9. He has 2 or more conditions that put him at high risk. That's Down syndrome and a reactive airway disease. Per DHHS guidance, I'm contacting you, my PCP, so that we can get registered. I have documentation if you need it. No response. And the information that was sent to me is read this irrelevant link and it'll get you where you need to go. I say irrelevant link because the registry was not applicable. I wasn't able to access that for my particular situation. Also, the registry is not in our hands. It's being formulated by the Dartmouth-Hitchcock system. From this registry, Dartmouth will be sending a list to the state. You'll get an invitation from the state by email to register for your vaccine. Not comforting. I think I understand what you're saying. The medical records indicate that my son has qualifying conditions. Therefore, the computer is going to make sure that my husband and I get emails. It's hard to trust a computer to do all of that. So is there a way to verify? Is there a central office at Dartmouth Hitchcock that one could call? So I got a phone number and it led me nowhere. So it came to registration day. It was time to change course again because the PCP can't help. So back to the pediatrician. The professionals on the town hall had said that the medical professional is responsible for uploading the medical verification form to the Department of Public Health Services. I send a link to the form. Have you filled out this form? No response. Meanwhile, many irrelevant emails from Dartmouth Hitchcock on vaccine update and messages in my personal Dartmouth My DH account that don't apply to anybody in my situation. No one's talking to the caregivers. A week later, good morning, I'm listening to WKBK. They're explaining the process, just checking to see whether we've been uploaded to VAMS. Thanks very much. I'm sorry, but parent information has not been sent to the state. We're not sure how to do that. I can let you know as soon as it has, though. Another week passes. Others have already been vaccinated. I'm getting really frustrated. I'm hearing from parents around the state that they've been scheduled, but no one in the Monadnock region knows how to schedule because we're served by Dartmouth Hitchcock. Several days later, we're in the process of gathering parent information to upload to the state. This is coming from DH. Can you give me your email, your phone number, and your date of birth? Yes, we're getting somewhere. Finally, I got a call in the middle of February. The Department of Health and Human Services had Maxwell on their list. Maxwell's a minor, he's 10 years old. He can't get the vaccination. This call is pertaining to his vaccination. However, the gentleman was not able to register me or my husband because there was a wrong checkbox on the form. The above referenced individual is a parent caregiver was not checked off by the Dartmouth Hitchcock folks who submitted the form. The response to this from the folks in my pediatrician's office was, sorry for the confusion. Dartmouth Hitchcock is able to follow a slightly different process and we're not completing forms for each parent. Okay, so where do we go from here? Well, I forwarded you and dad's info to the nurse compiling the information. She sent it out to the state. The clinical leader is going to check and see what's going on, what's wrong. Okay, so I finally got an email about a week ago. I was able to go and register. It's a happy story in the end. We got put on for the 30th of April, but with so many parents and other individuals like me who are still struggling through the murk, it remains impossible to know how large phase 1B is, even though we're being told that phase 1B will be complete in March. I remind you, my appointment is not until April 30th. Thank you.
Thank you, Lisa. We're also hearing that parents are being told at this time that there will be no appointments scheduled in May. Those are reports from families. We don't know if that's accurate. Again, thank you, Lisa. Next, we are joined by Kim Habib, mother of 2 from Salem. She is the chairperson of her local Family Support Advisory Council and is a 2019 graduate of the New Hampshire Leadership Series.
Thank you, Lisa. Thank you very much. Hello, I'm Kim Habib. I live in Salem, New Hampshire. I'm also a parent and primary caregiver for my 18-year-old daughter. She experiences compromised health issues since her birth. At 1 year old, she was given the diagnosis of cerebral palsy. And at 5 years old, she experienced a status epileptic seizure, which guaranteed a ride to the Boston hospital. Her needs are complex and very time consuming. I administer the medications, even though I don't have a nursing license. She needs assistance to get out of bed by herself and for all activities of daily living. She requires direct support for toileting and accessing her remote schooling every day, along with her therapies, including vision therapy, occupational therapy, physical therapy, and speech. You see, I can't afford to be sick or call out because I'm her primary caregiver and parent. After the paid caregivers get to go home, I'm still on the clock 24/7. I'm not paid, but I provide the same support as a healthcare worker that the state has deemed eligible in phase 1A. Yet there is no clear way for me to register for a vaccine. My level of assistance is very important in my daughter's life and allows her to live at home with her family instead of a group home or an institution. We are the glue that keeps the family running smooth. We are the ones up late preparing everything for the next day. We need to protect and realize the importance of these caregivers and their roles in the state of New Hampshire. We need to be a priority in getting this vaccine so our health compromised children and adults are able to give the life of dignity and valued members of their community with our support. We have significant workforce challenges in the state as it is. Who will care for our children if we get sick? As of today, neither one of us have a scheduled appointment. Even though my daughter qualifies, there are no appointments available until the end of April within a 100-mile radius of where we live. I am looking to the governor to communicate to the Department of Health and Human Services the importance of providing clear guidelines on how to register. And when you are an unpaid caregiver who is providing direct supports and services to a child over the age of 16 who is medically vulnerable. This needs to happen before the next phase begins. Thank you. Thank you for your time and consideration.
Thank you so much, Kim. Last, we have comments from Sandy Whipple.
Good morning. My name is Sandy Whipple. My adult daughter has a disability and underlying medical issues of varying nature, including but not limited to obesity, intellectual disabilities, and anxiety disorder. She lives and works independently in a New Hampshire city with amazing support services provided by an area agency in order to avoid a residential setting. When the COVID vaccine became available for Group 1B, I suggested to my daughter she should approach her healthcare provider for a medical verification to obtain the vaccine. She was quickly denied and told she did not meet the criteria set forth by the governor. Unlike many in the general population, her job does not afford her the luxury of working from home. With disabilities that preclude her from driving, my daughter faces an additional exposure each and every time she uses public transportation or taxi or Uber in order to get to her job. Critical support services, like her direct support professional, have been curtailed until such time as she receives her vaccine, when it will then once again be safe for her DSP to provide these lifeline in-home services. The denial of a vaccine is preventing my daughter from receiving the face-to-face services that support her to live in her community. As a population, people with disabilities are often isolated and unseen. She's a vulnerable person. How does it not make sense to deny her a vaccine? I have informed staff at DHHS of these challenges, spoken with her healthcare providers and staff at the area agency. No solutions have been created to correct what is going on for people with disabilities and their families. Thankfully, just this week, my daughter was contacted by her area agency, which explained that they advocated for and received an allocation of vaccines to give to some of their clients, including my daughter. But the questions of equity and access for others in similar situations looms large in my mind. As a self-advocate, she requested a medical verification from her physician and was denied. Yet somehow the area agency could advocate for a group of clients, and these same people whose doctors refused to verify them are now scheduled to receive a vaccine. And here's another barrier. If my daughter had been verified by her PCP, what would have been her access point? Was she expected to take public transportation and then walk through the line of cars, or pay for Uber to transport her, then sit in the line for up to 2 hours? What of others with disabilities who don't have family to be their voice, or help them to receive, process, and navigate this confusing and ever-changing landscape in order to remain safe? Governor, please instruct the Department of Health and Human Services to swiftly create an efficient, public, and transparent process so that people like my daughter can easily be verified, register for, and receive a vaccine.
Thank you so much, Sandy. These are powerful stories that illustrate the varieties of ways in which families impacted by disability and individuals who have medical vulnerability are being left behind. In closing, I'd like to say that inaction on the part of those who are either unable or unwilling to repair systemic vaccine registration glitches is tantamount to ignoring one of the Granite State's most vulnerable populations, the disability community. Able New Hampshire and members of the disability community across the state call on Governor Sununu to instruct public health officials that registration for phase 2 will not begin until this healthcare inequity is resolved. People with disabilities, those who are medically vulnerable, and their caregivers must have appointments before registration in New Hampshire and scheduling for phase 2 begins. We also request that the governor disseminate clear guidelines for caregivers and adults with disabilities to be able to easily register for a vaccine. Details on this second ask can be found on Able New Hampshire's call to action document being sent to Governor Sununu following this presser. We're now going to take questions from the media, if there are any. All righty, it looks like we have provided a great deal of information, and we are grateful for your being here today. If you'd like a list of questions for the governor, please let us know. One of those questions might be, Governor Sununu, in Massachusetts, the process for registration does not require verification. Massachusetts is a self-attestation state. So if you say that you are a person who is medically vulnerable or that you have a complex constellation of disabilities and qualify, Massachusetts is trusting their citizens to self-attest. Why have we burdened New Hampshire medical care providers and the medical system with frantic family phone calls and paperwork and faxing? Why? Again, thanks for your time. And thank you for attending our press briefing.